Thank you, Mike. Good afternoon, everyone. My name is Paul Bannister. I'm the Chief Information Officer. So it's been another busy year in the digital space, building on the infrastructure improvements we made in the two preceding years. In addition to supporting a number of the innovations that Mike just referenced, we took the big step of launching our electronic patient record. We went live with Cerner Millennium at the end of November 2021, enabling us for the first time to present the majority of our patient data to the clinicians in a standardized format at the point of care. This enhances our ability to provide safer, higher quality care, and in time will enable us to be more efficient with our use of resources as well. I'd like to take this opportunity to thank all of the staff from across the professional disciplines, both at West Herts, but also our partners at the Royal Free Hospital Group, for their hard work and enthusiasm on such a significant project. And that will continue throughout this year, as well as we continue to drive benefits from having an integrated system. If we could move on to the next slide, please. So that's the EPR that I've just talked about, and if we could move on again. So during the year, we've had some other notable achievements, including the upgrade of our pathology systems, the removal of significant volumes of paper used across the trust as we transition from manual records to a fully digitized record, and perhaps most significantly, the launch of our shared care record across the ICS. So this is a program that West Herts led across the system, included 16 provider organisations from across Hertfordshire and Essex, enabling clinicians to see as live patient data from a range of systems, regardless of which organisation they work in. And we very much hope to build on that as we move forward. And if we go to the next slide, please. And we hope the work we've done this year will continue further as we drive our EPR optimization and start to build what's called an electronic health record, where we hope to achieve a view of the entire patient record across their entire care journey. And perhaps most excitingly, later in the year, we look to launch our patient portal, which starts to join up the patient's view of their medical record with the clinician's view of their medical record, hoping to have a more integrated and seamless journey across their health and well-being, as opposed to just the care when they're in the hospital. So hopefully lots of exciting stuff to do, and we look forward to continuing our digital journey. I'm going to stop there and hand over to our Chief Strategy Officer, Claire.